Welcome back to the WHHI-TV Daily News. With me now is Dieesha Hicks, and she is the manager of the State Health Insurance Assistance Program. Wanted to make sure I got that right, otherwise known as SHIP. Thank you for being here this morning.
That is correct. So I just want to tell you a little bit about what SHIP does. So it's a long name, but basically we are the Medicare advocates for Beaufort County, Colleton, Jasper, and Hampton County.
Okay.
So everything Medicare under the sun, we teach people about understanding their benefits. We help them enroll with state plans that might help lower their drug costs, health care costs, fraud cases, appealing claims. So pretty much anything someone needs with Medicare, they can call us.
So any confusion they have, you are the lady that's going to help them understand it.
Right, in a safe place. So
Yes.
they're not worried about anybody selling them anything.
Right.
We're unbiased. We don't work for any of those companies.
Yeah, and that's a very important point because sometimes you can get really bogged down in all that stuff.
Right.
So let's talk a little bit, though. We have some important deadlines coming up at the end of March. So we want to first talk about the Medicare General Enrollment period, and that is ending on March 31st. But tell us a little bit about what that means and what people need to be aware of before that deadline.
So the general enrollment period is for those who did not enroll in a Medicare in their initial enrollment period, pretty much before they turn 65. So now they get the opportunity from January 1st to March 31st to enroll. They may have to have some penalties. Medicare penalties are for a lifetime, so it's 10% for every year you have not enrolled.
Okay.
But it's definitely important to get that enrollment so they don't have any breaks in coverage.
Right, and I mean, that's a very good point. I didn't know that. I'm not eligible yet, but I wouldn't have known that there was penalties or that you had to do it in a certain amount of time. So that's really important information. And then the other thing we want to talk about is the Medicare Advantage Open Enrollment. And so what is different about that? It also ends on March 31st.
Right. So about 2 years, CMS created the Medicare Advantage Open Enrollment, and that's strictly because during the regular open enrollment period, which is October through December, where you can change plans, a lot of people get put in the plans they don't need. It could be an agent, not saying all agents are bad, but it could have been somebody that put them in something they didn't need. Or they missed the open enrollment period. So this gives them another opportunity to get back into a plan that suits them. So if they have a Medicare Advantage plan, they could switch back to original Medicare by getting a drug plan, or they could just switch another Medicare Advantage plan.
Okay. And talk to us a little bit about the plans and what somebody should be aware of when they're looking to sign up for a plan for themselves. What is really important to always have, and what are some things that maybe you wouldn't need?
So what I tell most people is the most two important things is, one, make sure your doctor's in that network. Because if you're coming into Medicare and you have Dr. Wilson and you love Dr. Wilson, but he doesn't take that Advantage plan, you have to find a whole new doctor.
Right, okay.
So making sure your doctor is in that network, and definitely making sure all of your drugs are covered.
Right.
Because a lot of people get hooked on the glitz and glamour. We know everything that glitters is not gold, so they're like, well, I might could get this money for this, but if your drugs are not covered, you're still spending more money than you need to.
Right.
So those are the two most important things I tell them to look out for.
Yeah, and those are absolutely very important things. So if somebody is watching and they would like to get a hold of you because they have questions and they don't know how to deal with these deadlines and so forth, how do they get in touch with you?
Well, you guys can call me at 843-473-3991. Again, I am Dieesha Hicks, your local certified Medicare SHIP, and we are definitely here to help you.
Yeah, and remember that SHIP. That's a lot easier to say than State Health Insurance Assistance Program.
It is. I don't really like to say it.
And if you don't like to say it, it's certainly going to be hard for me. Dieesha, thank you so much for being here today to share about this.
You are so welcome. Thank you for having me.
Yeah, it's such an important program, so we're happy to have those details. Thank you again.
Thank you so much.
And we'll be back in just a moment, so stay with us.